So in this video we will talk about as to what is the blighted ovum pregnancy and what are the clinical features and how it is can be diagnosed, and which are the women who are at the greater risk in whom the blighted ovum pregnancy can be seen. So when we talk of the blighted ovum pregnancy, it is a pregnancy in which the ovum, in the fertilization of the ovum is there, and once the ovum is fertilized with the egg, it gets implanted into the uterus as well. But what is happening is that the embryo is failing to develop. So in a blighted ovum pregnancy, the once after the fertilization has taken place, the zygote which is going to get implanted into the uterine wall, so it gets implanted and there is formation of the gestational sac as well. But after this implantation has taken place, the embryo is either resorbed or it fails to develop. So mostly in a normal pregnancy, it is seen that by at least by the 6 weeks, it can be seen that during the routine ultrasonography, the embryo can be easily seen in a normal pregnancy. But in a blighted ovum pregnancy, even after the last menstrual period, even after the 6 weeks of the last menstrual period, the embryo is not seen in the gestational sac, as well as the gestational sac is also there, the placenta is also there, everything is there, but the embryo is failing to develop. So in such cases, what happens is that the women who are pregnant with such a thing, they are going to have the normal routine pregnancy test positive. So even if they are going to conduct the pregnancy test, since just because the placenta has formed, the gestational sac has been formed, but the embryo is failing to develop, so in such a case, whatever the pregnancy hormones are there, the body is constantly releasing, and if such a woman is getting the pregnancy test done in the pregnancy kit, what it is seen that the test will come positive. Now most this blighted ovum pregnancy, it is the most one of the most important cause of the first trimester miscarriage. So in such a case, the miscarriage is there, and the early symptoms, what can be seen, it can be seen in the form of vaginal bleeding or spotting. Apart from this, even from the vaginal region, there can be slight bleeding or spotting can be seen, as well as the passage of light gray tissue or clots can be seen, which can be one of the very important symptom which can be seen in the first trimester in a blighted ovum pregnancy. Apart from this, there can be cramping, mild to moderate cramping in the pelvic or the